I'm Cara and I'm going to be doing a sterile dressing change. Just for time's sake, I already checked the doctor's orders with the patient's charts to make sure that this is the procedure that needs to be done. And I washed my hands and also provided privacy as I came into the room. And I've already raised the head of the bed a little bit for the patient. I am about to just start to check to make sure it's the right patient. So before I get all started, I'm going to ask my patient, can you please tell me your name and date of birth? So this patient would respond with Dobra, hopefully. And I'll explain to my patient, I'm Cara, I'm going to be your nurse, and today we're just going to be doing a sterile dressing change. It shouldn't take longer than 5 minutes. Do you have any questions? So with that, I'm going to ask you to please just turn your head away. I'm just going to expose the site. First, I'm going to be putting on my gloves. And open the box. I have only one mask, but I would have two normally, so my patient would have a mask, and I'm going to have a mask. Okay. I am first going to be removing the dressing in the way that the insertion or the line was inserted. So let's go this way, and then I will dispose of it. And I'm also going to take out this dressing. Okay, so right now I'm just going to be observing, seeing if there is any redness, any exudate that could be going on, any signs of infection. If there are any, I will have to document it, but just keeping in mind for right now what's going on with these sites. So now I am going to take out my sterile field, and before I open it, take off my gloves. That's fun. Anyways, hopefully that won't happen in real life, but it might. So I had been practicing before this, before we found out which ones we were going to be doing, but apparently I forgot to take it out of the trash can. So normally it would be in the blue paper wrapping, but I'm just going to take it out for now. So normally those would be there, and I'm just going to pretend that they're in sterile field. Apologize about that. So first I'll take my chlorhexidine applicator, and I'm going to stabilize my central line and scrub it for about 60 to 90 seconds. But I'm not going to do that for time's sake. So spend 60 seconds. I'm going to throw that away, and then I will be putting their new dressing on, and since this hand is clean, it's not sterile any longer, I'll just be holding up the central line and putting the dressing on like so. And now I'll be grabbing my Tegaderm, placing it over top like so. I would have taken off the backing, of course, but and I would have dated it, initialed it, and put the time down that I did the dressing change. And after that, I will put everything back to how it was when I came into the room. I will document if there was any redness or exudate or anything that needs to be documented, and put the head of the bed down, wash my hands as I walked out, and asked the patient if there was anything else I could do for him or her before I left. So that is my validation.